FQHCs, or Federally Qualified Health Centers as they are designated, perform an important role in the healthcare delivery system in our country and especially in our state. They provide services to vulnerable patient populations. They provide access where it may be difficult just because of where people live, like in rural settings, or to populations that are socioeconomically disadvantaged.
So this is an essential part of MCG's mission. And as a state medical school, it's important that we meet the healthcare needs of Georgians. I think from a student's perspective, this is an awesome place to do a clerkship or do an elective. They're going to really get to see holistic primary care at its best when they go to these areas.
I've really pushed, and I know the medical colleges has too, to try to get students trained in the rural areas so they can see that you can practice good high-quality medicine in the rural areas. You don't have to be at a major medical center to practice good quality medicine. And part of our program is to have the students come out and the residents come out and train in the rural area. We know when they see it, they like it, and they end up wanting to come back, and we can spread physicians throughout the whole state using that model.
I think partnering with Medical College of Georgia to be able to bring students out to rotate at our health centers, like Martin, the medical student that's rotating with us for the next 6 weeks, I think it gives them a unique opportunity to work with a primary health care provider that's kind of on the front lines.
I just thought that it would be a great learning experience. Back in my undergraduate years, I volunteered a little bit in underserved communities, so I thought that having my family medicine rotation in FQAC would be like a great experience for me. I've really been blown away by not only the patient population, but also I get to work with a wide breadth of providers and learn how they utilize their different skills to connect with these patients.
So this is my first opportunity kind of immersing myself in an FQHC. Prior to this, I'd only worked at larger institutions that had a lot more resources. So it was interesting to compare that to these smaller clinic locations and talk to both the providers and the administrative staff on what day-to-day life is, as well as interact with some of the patients about how the clinic has affected them personally. I really enjoyed the rural aspect of the clinic and getting to work with these patients who have lived in these communities for a long time and build those relationships with them, so I could see myself going back to a similar clinic in the future.